Blood pressure. Blood pressure is the force of your blood pushing against the walls of your arteries. Here's a breakdown of what that means. Arteries. These are the blood vessels that carry oxygenated blood from your heart to the rest of your body. Heart's role. Each time your heart beats, it pumps blood into these arteries, creating pressure. Blood pressure is measured in millimeters of mercury, mmHg, and is given as two numbers. Systolic pressure, the top number. This is the maximum pressure in your arteries when your heart beats and pumps blood out. Diastolic pressure, the bottom number. This is the minimum pressure in your arteries when your heart is at rest between beats, filling with blood. Methods of measurement. 1. Manual auscultatory method with the help of sphygmomanometer and stethoscope. This is the traditional and often considered gold standard method for measuring blood pressure in a clinical setting. Equipment. Sphygmomanometer consists of an inflatable cuff, a pressure gauge, manometer, historically mercury, now often aneroid or hybrid digital manual, and a rubber bulb for inflation. Stethoscope, used to listen to the sounds of blood flow. Procedure. 1. Preparation. The patient sits comfortably with their back supported and feet flat on the floor. The arm chosen for measurement, usually the dominant arm, but both may be checked initially, should be bare and supported at heart level. 2. Cuff placement. An appropriately sized cuff is wrapped snugly around the upper arm, just above the elbow. 3. Inflation. The cuff is rapidly inflated using the rubber bulb until the pressure in the cuff is high enough to temporarily stop blood flow in the brachial artery, usually about 30 mm of mercury above the point where the radial pulse disappears. 4. Deflation and listening. The healthcare professional slowly releases air from the cuff while listening with a stethoscope placed over the brachial artery in the inner elbow. Systolic pressure. As the cuff deflates, the first faint, tapping sounds, known as Korotkov sounds, are heard. The reading on the pressure gauge at this moment is the systolic blood pressure. This signifies the point at which blood just begins to flow through the artery again. Diastolic pressure. As more air is released, the Korotkov sounds become louder and then eventually fade and disappear. The reading on the pressure gauge when the sounds completely disappear is the diastolic blood pressure. This indicates the point at which blood flow is no longer restricted. 2. Automated, oscillometric method. This method is widely used in clinics, pharmacies, and for home blood pressure monitoring due to its ease of use. Equipment. Digital blood pressure monitor. Consists of an inflatable cuff connected to an electronic device with a digital display. Procedure. 1. Preparation. Similar to the manual method, the patient sits comfortably with the arm supported at heart level. 2. Cuff placement. An appropriately sized cuff is wrapped around the upper arm, most accurate. Some devices also measure at the wrist or finger, but these are generally less reliable and not recommended by major health organizations like the AHA for routine monitoring. 3. Automatic measurement. The user simply presses a button. The device automatically inflates the cuff, senses the oscillations, vibrations, caused by blood flow in the artery as it deflates, and then displays the systolic and diastolic blood pressure readings, often along with heart rate. The device uses an algorithm to interpret these oscillations and calculate the blood pressure. 3. Ambulatory blood pressure monitoring. This method provides a comprehensive picture of blood pressure fluctuations over a 24-hour period. Equipment. A portable, battery-operated blood pressure device with a cuff worn on the arm. Procedure. The device is programmed to automatically take blood pressure readings at regular intervals, e.g., every 15 to 30 minutes during the day and every 30 to 60 minutes at night, while the patient goes about their normal daily activities, including sleeping. The recorded data is later downloaded and analyzed by a healthcare professional. Advantages of ABPM. Detects white coat hypertension. This is when blood pressure is elevated only in a clinical setting due to anxiety. Detects masked hypertension. This is when blood pressure is normal in a clinic but high at home or during daily activities. Assesses nocturnal blood pressure. Important for identifying non-dippers, those whose blood pressure doesn't drop sufficiently at night, which can indicate a higher cardiovascular risk. Evaluates treatment effectiveness. provides a more accurate assessment of how well blood pressure medication is working throughout the day. Clinical interpretations. Guidelines for blood pressure categories can vary slightly between organizations, e.g., American Heart Association, American College of Cardiology versus European Society of Cardiology, European Society of Hypertension, but generally, they are normal blood pressure, less than 120 mm of mercury systolic and less than 80 mm of mercury diastolic. Clinical significance. Indicates a healthy cardiovascular system. Encourage maintaining a heart-healthy lifestyle. Elevated blood pressure. Systolic between 120 to 129 mm of mercury and diastolic less than 80 mm of mercury. Clinical significance. This is a warning sign. While not yet hypertension, it indicates a higher risk of developing it. Lifestyle modifications, diet, exercise, stress management, are crucial to prevent progression. High blood pressure, hypertension, stage 1. Systolic between 130 to 139 mm of mercury or diastolic between 80 to 89 mm of mercury. Clinical significance. Diagnosis of hypertension. Lifestyle changes are highly recommended. Medication may be considered, especially if the patient has other cardiovascular risk factors, e.g., diabetes, kidney disease, high risk of heart attack or stroke. High blood pressure, hypertension, stage 2. Systolic 140 mm of mercury or higher or diastolic 90 mm of mercury or higher. Clinical significance. More severe hypertension. Lifestyle changes and medication, often a combination of 2 or more antihypertensive drugs, are typically prescribed to lower blood pressure and reduce the risk of serious complications. Hypertensive crisis. Systolic higher than 180 mm of mercury and or diastolic higher than 120 mm of mercury. Clinical significance. This is a medical emergency requiring immediate attention. Symptoms like chest pain, shortness of breath, back pain, numbness, weakness, vision changes, or difficulty speaking indicate a hypertensive emergency and require calling emergency services. Even without symptoms, if the reading is consistently this high, medical evaluation is needed. Thank you.